Good day to all. I'm Dr. Fazeela Begum, Assistant Professor from the School of Life Sciences, B.S. Abdul Rahman Crescent Institute of Science and Technology, Chennai, here to present on the topic phytochemicals in cancer therapy. My areas of research specialization include molecular biology and biochemistry, cancer therapeutics, cell signaling, molecular diagnosis of disease, phytomedicine, drug discovery and design. So, on this occasion of the National Science Day, I would like to present on the topic the role of phytomedicine in cancer therapy. With cancer and CAM. So, cancer is a complicated disease and is the second leading cause of death worldwide. Although research is keenly focused on the management of cancer, the scenario still requires more time for gaining a control on cancer and also in maintaining its complications. Till date, chemotherapy is the leading strategy in the management of cancer. However, the patients undergoing chemo face several side effects, and hence people rely on the complementary and the alternative medicine as a second choice. This camp comprises of some modalities like herbal medicine, homeopathic medicine, and nutritional supplements. The use of CAM is practiced throughout the world and thus proving that in Europe 26% of the patients rely on CAM, followed by Germany and Canada where nearly 44 to 46% of the patients rely on the use of CAM in cancer therapy. Similarly, in India, 56% of the patients and in the US, 68% of the patients depend on CAM in the management of cancer. To the anti-cancer phytochemicals. So phytochemicals are the active constituents of plant origin. They can be classified as the flavonoids, alkaloids, glycosides, carotenoids, anthraquinones, phenolics, and the organosulfur compounds. So these are widely employed for the treatment and the prevention of various diseases either alone or in combination with other drugs. So the phytochemicals and the derivatives exhibit a wide range of therapeutic actions like the antioxidant, anti-inflammatory, anti-diabetic, analgesic, anti-cancer, neuroprotective, and antimicrobial activities. So hence, these are a significant source for investigation and the development of new drugs. Some of the anti-cancer agents derived from the plant origin which are currently approved for clinical use include the vincristine, vinblastin, taxols, topotecan, irinotecan, camptotecan and the derivatives and also the epipodophytotoxins. The current slide shows the structures of the lead anti-cancer phytochemicals including vincristine, vinblastin, ellagic acid, quercetin, curcumin, and also the resveratrol, apigenin, and genistin. So let us see about the mechanism of the anti-cancer action of these phytochemicals. So the phytochemicals confer their anti-cancer activities through a number of mechanisms. So these can be classified as the modulation of the cell signaling pathways, by the induction of apoptosis, by preventing any epigenetic changes, by inducing a cell cycle arrest, or by causing a damage in the DNA. So when we talk about the cell signaling pathways, the commonly targeted pathways include the mitogen activated protein kinases or the MAP kinase and the extracellular signal regulated kinases, the ERK, the nuclear factor kappa B, that is the NF kappa B, and the Janus activated kinases, the signal transducer and activator of transcription protein, that is the STAT, which may be either dysregulated or overactivated in cancer. So this alteration in the metabolism of different types of cancer cells leads to their sustained angiogenesis, their continuous proliferation, de-differentiation, and the metastatic ability. Hence, modulating these signaling pathways serves as a major or a crucial role for the prevention and treatment of carcinogenesis by various drugs. So let us see about the anti-cancer phytochemicals, their sources, and the underlying anti-cancer mechanism. So the phytochemical aloin and emodin are isolated from aloe vera. So they possess anti-angiogenic activity and they are effective in human lung cancer. So the mechanism of action is by the induction of apoptosis and also the decrease autophagy. Similarly, apigenin, it is isolated from Petroselinum crispum. It is effective against human breast cancer and its mode of action is by the induction of apoptosis and also modulating the cell signaling pathways in cancer. Curcumin, isolated from Curcuma longa, is effective against stomach cancer. It possesses anti-proliferative activity against the human breast epithelial cancer cells. So the mechanism of action includes it blocks the EMT, that is the epithelial to mesenchymal transition. It induces apoptosis by blocking the major cell survival pathway, namely the PI3K and the AKT. It also downregulates the MDM2 and also it suppresses the cyclin D1 and also the cyclin E. At the same time, it also upregulates the expression of the tumor suppressors, especially P21, P27, P53. The next compound is epigallocatechin gallate. It is isolated from Camellia sinensis. It possesses profound anti-cancer activities. So the mechanism of action includes by inhibiting the functions of the HSP70 and 90. It also inhibits hypoxia and also serum-induced accumulation of the HIF1 alpha and the VEGF expression. Thereby, this compound or the phytochemical has the ability to control angiogenesis and also metastasis. Then about resveratrol. So it is isolated from Polygonum cuspidatum. It is effective against different types of cancers, including the cancers of the colon, breast, stomach, prostate, and the ovary. So the mechanism of action, it interferes with the AKT activity and also it causes apoptosis and brings about a cell cycle arrest in the G1 phase. Quercetin, it is isolated from Vitis vinifera and it is effective against the human breast cancer, CACO2 cells and the HEPG2 cells. So the mode of action, they interfere with the cell cycle, they decrease the expression of the cell cycle genes, at the same time they increase the expression of the caspase-3 and caspase-9 and also they have a modifying activity and they protect the cells against the toxic effect of hydrogen peroxide. Ellagic acid, it is isolated from Punica granatum. It has efficient anti-angiogenic activity. So, the mechanism of action includes anti-mutagenic activity. It prevents the formation of DNA adducts and also it has efficient free radical scavenging activity and also it inhibits the VEGF and the MMP pathway and also it decreases the production of ATP in cancer cells. Berberine. It is isolated from Berberis lichen and it is effective against cervical cancer cells, against human promeiotic cells, and the HL60 cells. It is shown to induce a cell cycle arrest in the S phase, thereby it decreases the expression of VEGF in the mice models, and also it is shown to decrease the MMP2, and also it decreases or it prevents the angiogenesis and metastasis. So this slide shows the natural chemopreventive agents. So these includes the already discussed resveratrol, epigallocatechin gallate, and then phytoestrones, carotenoids, quercetins, apigenin, lycopene, and then anthocyanins, etc. Now moving on to curcumin. Curcumin is chemically diferroyl methane. It is a chief pigment isolated from Curcuma longa. The bioactive compounds of turmeric are called as curcuminoids, and these curcuminoids comprise the curcumin, tetrahydrocurcumin, bis-D-methoxycurcumin, and the D-methoxycurcumin. Among these, the tetrahydrocurcumin is a natural occurring curcuminoid, and it is of great interest because of its high solubility in water. The molecular targets where curcumins will bind and induce the cancer cell death include the cyclooxygenase 2, the nuclear kappa B, the TNF or the tumor necrosis factor alpha, and the cyclin D1. Curcumin is found to reduce the expression of the cyclin D1 and also the CDK4 in breast and skin cancers. It is also found to downregulate the expression of the angiogenic genes including VEGF, angiopoietin, MMPs 9 and 3, and also hence curcumin serves as a promising cancer therapeutic and chemopreventive agent. Curcumin also exhibits certain ideal chemopreventive features which include less toxic side effects, cost effectiveness, and also easy accessibility. About resveratrol. So resveratrol is abundantly present in grapes and berries. It is chemically 3,5,4-trihydroxytranstilben. It has significant effects with major age-related diseases which include diabetes, neurodegenerative disorders, arthritis, coronary diseases, and pulmonary illness. Research reports suggest that resveratrol modifies all the steps involved in carcinogenesis, including the initiation, promotion, and progression of cancer. Hence, it is found to reduce the cancer cell multiplication and progression. It also induces programmed cell death and also reduces the inflammatory response and the response to angiogenesis. Hence, it is found to prevent metastasis of tumors. The next phytochemical, that is apigenin. Apigenin is a flavonoid and it is rich in fruits and vegetables. It is chemically 4,5,7-trihydroxyflavone. It is well known for its established anti-angiogenic properties, which are linked to the regulation of various signaling pathways. It also induces the induction of apoptosis and it prevents the cancer cell transformation. It is also reported to induce a cell cycle arrest. Apigenin has an inhibitory effect on the tobacco smoke related cancers and also in the HPV infections. Especially, it inhibits a tobacco-specific carcinogens, that is the NNK, through the focal adhesion kinase and the extracellular regulated protein kinase, that is the ERK signaling pathway. In the breast cancer models of mice, apigenin exerted an inhibition of the PI3K-AKT pathway and also it decreased the expression of the HER2 proteins. Phytochemical is epigallocatechin gallate. So it is abundant in green tea. It is a strong antioxidant and also a chemopreventive compound. The prominent regulatory effects of this epigallocatechin gallate depends on its effectiveness in inhibiting various signaling pathways including the JAK-STAT, the MAPK, the PI3K and the AKT, the Wnt-Notch signaling pathways, the NF-kappa B and the AP1. It has also established tumor suppressor activities including its effect on the P21, P53, P16 and the RB. Genistin. Genistin is produced in legumes. It is an isoflavone. It is chemically 4,5,7-trihydroxyisoflavone. So these genistin are commonly called as phytoestrogens because they have a structure similar to that of the human estrogen. About the mechanism of action, genistein blocks the PTK signaling mechanism through the protein tyrosine kinase inhibition. Thereby, it indirectly suppresses the proliferation of cancer cells. The other important molecular targets of genistein are topoisomerases 1 and 2. To put in a nutshell, the slide shares the interaction of the phytochemicals with the various signaling molecules in cancer chemoprevention. So any phytochemical can bind with the receptor. It can induce the MAP kinase pathway, and then it can increase the expression of the caspase cascade and the ERK signaling. Thereby, it can bring about the transcription of the anti-cancer proteins, which can induce apoptosis. Similarly, they can act on the receptor tyrosine kinase, especially the AKT, the NF-kappa B, and the mTOR signaling pathways. Thereby, they can induce the anti-proliferation activities. Similarly, they can activate the GSK3 beta pathway and the beta catenins. Thereby, they regulate the invasion properties and the migration of the cancer cells. Similarly, some phytochemicals they act on the JAK and the STAT pathway. Thereby, they are involved in exhibiting their anti-angiogenic properties. So, as a whole, the phytochemicals interact with any of these pathways or more than one pathway, and thereby they regulate apoptosis, proliferation, invasion, metastasis, and angiogenesis of cancer cells. Hence, to conclude, cancer is a highly complex disease and is associated with numerous complications. Hence, conventional therapeutics are the gold standard treatment, but they impose major side effects. Hence, there is an alternate need to discover more useful anti-cancer phytochemicals. Further, these new phytochemicals are expected to reduce the economic burden imposed by the conventional therapeutics on the cancer patients. So, these anti-cancer phytochemicals and the combination agents are required to possess less side effects, and also they are expected to modify the therapeutic effects of anti-cancer drugs. Nearly 5,000 natural compounds, nutraceuticals, and extracts are reported to have anti-cancer potentials. Phytochemicals, in combination with cancer therapeutics, were found to mediate a positive anti-cancer activities through the modulation of various signaling pathways. And these are promoting apoptosis. They also inhibit cellular proliferation and also they mobilize the immune system. Phytochemicals and chemotherapeutic combinations mediate their inhibitory effects on the cancer cell's growth and thus promote strategies for the discovery of more useful drugs. It may be concluded that the concomitant use of herbal medicine with anti-cancer drugs has a synergistic, antagonistic, and deleterious effects. Therefore, natural medicine producing synergistic effects should be sorted out and integrated into chemotherapy for the welfare of patients and human life. I would like to express my heartfelt thanks to the management, Vice Chancellor, Pro Vice Chancellor, Registrar for giving me the opportunity to be a part of this National Science Day. I would like to express my sincere thanks to the team, School of Life Sciences for giving me the opportunity. I thank the Tamil Nadu State Council for Science and Technology and the National Council for Science and Technology Communication for co-sponsoring and supporting the event. These are my references. A continuation of the references. A warm thank you to you all for sparing your valuable time and joining the presentation. Thank you once again.